Okay, we're going to give a sub-Q injection. With the sub-Q injection, you can give that in the back of the arm and the upper outer thigh. You can give that in the above the gluteal area, the abdomen. And so whenever giving any injection, you're going to want to check the doctor's orders. You're going to want to check any allergies the patient has. You're going to gather your supplies. So when you're gathering your supplies, you're going to wash your hands. You're going to make sure that you're doing the 6 rights of medication. You're going to want to do the right patient, medication, route, dose, time, and documentation for each medication. You're going to get your correct syringe and needles for each injection. You're going to want to get the correct medication. You're going to check that 3 times whenever you're giving a medication. You're going to check your MR whenever you're removing it from storage, when you're preparing the medication, and then at the bedside of the patient. So whenever you are preparing the medication, you're going to wash your hands. You're going to get an alcohol pad for the vial. You're going to want to clean the top of the vial, and then you're going to want to inject however much air that you're going, or however much liquid you're going to take out. You're going to want to inject that much air. So we're going to give 0.5 mils. So then you're going to inject 0.5. You're going to withdraw 0.5 mils. And then with certain medications, you're going to want to verify this with another nurse to ensure that you have the correct amount. Okay, so you would recap that. You would change the needle if necessary after expelling any air that's in the syringe. It's just a little bit. Okay, and then I'm going to put the med back in already. Just pretend it's in there. Alrighty, so your medication is prepared. You're going to recap that, so then that way you have a safe transfer. And so then you're going to take it into the patient's room. You're going to introduce yourself. You're going to explain what you're doing. You're going to wash your hands, all of that. You're going to check for an allergy band. You're going to check for an alert band, anything like that. You're going to want to make sure. You're going to check the med again, make sure it's the right med. You're going to want to check, whenever you're drawing up the medication, you're going to want to check the expiration date of the medication before drawing any of that up. So whenever you're in the patient's room, you're going to depending on what med you're going to give, you're going to check, you're going to do an assessment. So if it's going to lower the blood pressure, you're going to want to get some vitals. You're going to make sure their blood pressure is high enough to get that. You're going to want to check for pain. If you're getting them pain medication, you're going to check all of that before and after giving the med. Okay? So I'm in the patient's room, and I am going to wash my hands, explain all of that to them. Whenever you are doing this, we're going to say this is the back of their arm. You're going to clean it with an alcohol pad. Clean the area. You're going to let that dry because you don't want it to sting. Okay, you're going to put your gloves on. Alright, clean the area really good. You're going to get the medication. You're going to uncap that needle, and whenever you are giving the injection, you're going to pinch up an area of fat because it's sub-Q. And you're going to do a dart-like motion at either a 45 or a 90-degree angle, depending on the amount of fat. So we're going to say that this person is hefty enough for a 90-degree angle. So we're going to go real quick like that. You're going to want to give medication kind of slowly. You don't want to push it all at once. And you do not want to rub the area afterwards. Alrighty. Withdraw. And then you're going to cap that needle however the needle is, and then you're going to put that in the sharps. Okay, you're going to assess the area, you're going to assess the patient, ask them how they're feeling, and then you are going to take your gloves off. You're going to wash your hands, you're going to ask them if they need anything else from you, and then you'll come back a little bit later depending on how fast medication works to see if you're having a therapeutic outcome. And that's it.